This is a new area that is emerging called digital pathology. This is very recent in the sense that it has taken off only in the last decade. Uh, it's a convergence of many different things that came together to start creating systems which are now capable of generating these images, and then we have computational systems which can handle the data. So this is truly a next frontier in medical imaging. Till now, medical imaging was mostly focused on radiology, and now we are moving to this new domain. And it is a convergence of many different types of modalities. And I'll talk about some of that today. So before I jump into what the motivation behind this work was, it is based upon a mission statement, which is part of our organization's mission, which is we have to work on things that improve the life of patients afflicted with cancer. If that doesn't work, if it cannot be shown that it affects somebody's life as a patient, then we are not doing that work. So that's the motivation behind this thing. And that gives us a different type of energy to do things when we work on problems. And some of these things we talked about during the panel, which was there is a global crisis going on with respect to cancer. The truly amazing figures are like by the time in the next 20 years or so, we'll see that 27 million new cases of cancers will be starting to be seen in the population, with 17 million cancer deaths. That's a huge number of deaths per year. We need to do something about it. And the trends we are seeing also are there's a critical shortage of specialized medical professional, and we are talking globally, not about specific pockets. Yeah, there are areas within the world which have got very excellent medical professional care, but when you look at a global phenomena, which is where cancer is afflicting everybody, it doesn't go to only the tertiary cancer centers and afflict people there. It goes to everywhere in the world. We also have an aging population. Patients are afflicted only at an older age, and this is causing other types of complications because at that age you already have other types of chronic diseases which confound each one of the other diseases. We are coming to a area in business where pharma understands that this notion of a blockbuster drug model is not going to work anymore. And we have to move much more towards a targeted therapy for personalized medicine. And also, we are looking at additional things that are happening in technology, new and exciting things, which are enabling us to understand cancer much at an earlier stage. So these are all things that are happening, which